Are you dealing with low back pain? Well, you wouldn't be alone. 60 to 70% of the American population will experience at least one bout of low back pain in their lifetime. So it's really common. And 95% of those cases are mild and not indicative of anything more serious. However, there are 5% that indicate a little bit more serious pathology. So I just want to run through some quick red flags. First off, my name is Dr. Gouveia with HealthFit Chiropractic. So things that I want you to pay attention to if they begin with your low back pain are you dealing with a fever that started with your low back pain? Have you had any unexplained weight loss, a trauma, or any change in bowel or bladder functions? Those are the types of things that they require further medical examination immediately. So if you're dealing with back pain and any of those, go get checked out. But when you come into our office, we're going to ask you all those questions. We're going to tease out those red flags. But we're also going to figure out exactly what's the root cause of your low back pain. We're going to take you through a full functional exam and look at what muscles might be weak, what muscles might be tight, and how they influence your back pain. Is it your lifestyle from sitting at a desk, or is it that you're an athlete and the sport that you're playing seems to be aggravating it? We're going to tease out all those different things, help you determine what you should do next in terms of management of your pain, and we're going to provide you with treatment which includes soft tissue, adjustments, and rehab exercises to not only get you out of pain, but build resiliency so that way you can manage your pain in the future and prevent it from coming back. So let's get started. So once you come to the office and we go through our detailed history and rule out any red flags, we're going to get into our exam. So the very first thing that we want to look at here is we want to look at range of motion. So he's going to put his feet together and go ahead and just try and touch your toes while keeping your knees straight. He's got pretty good range of motion there in flexion. Hands up overhead. I want you to push your hips forward and lean back for me. We're going to take a quick look to see how he moves exactly, because sometimes we want to know that the spine actually moves globally instead of just fulcruming over one joint, and that can be an indication for low back pain as well. Next up, he's going to have his hands at his side, and he's going to rotate to one direction. Okay, and go the other direction. We're going to ask if any of these are provocative, if they cause any of his symptoms. So the next thing I'm going to look at is he's going to have a seat right here. We typically go through a full neurological exam, which is sensory, motor, and reflexes, but we're not going to show you that today, but that's a part of our process. But one thing I do want to see is I want him to extend this leg all the way out. We're going to point his toe up, drop his head down to his chest, and we're going to ask if that reproduces any of his symptoms. And more importantly, does it reproduce his symptoms in the low back, locally? Does it feel like just a little hamstring tightness, or is the pain shooting down the leg? At this point, we want to rule out any radiating symptoms, radiculopathy, or nerve symptoms. If this is negative, we move forward with our mechanical exam. We actually have a video on sciatica, so if this was positive, we'd go down a different pathway a little bit. The next thing I want to look at is I want to have him actually just lift one knee up to his chest. What we're looking for here is instability or inability to brace. As you saw when he lifted, show again, he shifted his weight to the side. That's telling me that his core is not activated enough to actually create stability. So if Stefan were to stabilize and try and lift his leg up, you can see that nothing moves. He's not shifting his weight. He's not moving his hips at all. That's a good sign. But if I saw him shift, which I see in most of my patients, we're going to need to address that because that's a sign that he's not contracting his core enough and stabilizing that lumbar spine. So the next thing I'm going to have him do is actually spin around here, and he's going to pull one knee to his chest, and he's going to lean all the way back. We're going to look here to see if this leg floats at all or if the knee extends. This can tell us whether there's muscle tightnesses. You can sit back up. The muscle tightnesses we're looking for here, they're called your psoas or your hip flexors as most people know them, your rectus femoris, which is the quad muscle that crosses both the knee and the hip, and your TFL. They can all play a role in low back pain. They can play a role in other injuries as well, but most specifically, we're looking at psoas tightness or hip flexor tightness. It plays a huge role in postural low back positions, and so it's something that we would want to treat. So the last thing that we would do is I would have him lay on his back again, and we check how he breathes. So when he breathes, we want to see, does his stomach rise or does his chest rise? Most of us breathe through our chest these days. What we want to actually see is we want to see him actually breathe through his stomach. When you do that, you're actually using your diaphragm. So it's not truly stomach breathing, it's called diaphragmatic breathing. When we do that, we create pressure. And this pressurized system is, picture it like a beer can. If you have an empty beer can and you stand on it, you can crush it. If it's closed and it's pressurized, you could stand on it and hold your weight. Well, you have that can or that cylinder here. And so if we can teach our patients to breathe through their stomach, you can create this pressurized spot. And what it does is it stabilizes the entire spine. It helps them performance and it helps them through different different movements. So that's one thing that we also teach as a part of our treatment, especially if they're breathing through their chest instead of through their stomach. It's actually incredibly impactful, and it's one of the most useful tools we have. People don't believe me when I say breathing impacts their low back pain, but it sure does. So we've seen on Stefan, he's got some instability. So we're going to train the breathing in the next step. But we also saw that he had tight hip flexors. So part of our treatment is going to be actually treating those hip flexors. In order to do so, we're going to bring him up into hip flexion. We're going to do something called ART. And we're just going to pin it down, drop that hip to the ground, and we're just doing a lot of muscle releases on it. This is one of the most common treatments we have to perform on our low back pain patients just because of how much those hip flexors impact our back positioning. Next up, what we'll do is we'll flip him onto his stomach. And we'll actually use this table to our advantage. It's a really cool table that we use on a lot of our low back pain patients, which allows us to not only traction the spine, but to help perform some releases on his low back musculature. So the muscles that line the spine here, they're called your erector spinae group. They can often get really tight or go into a full spasm when a patient has a low back pain episode. And so in a way to release that is we can use this table, we can pin those muscles down, and we can lengthen them under tension. Again, this is a soft tissue treatment technique called ART or active release technique. The muscle off to the side is the next one we usually treat. It's called your quadratus lumborum, and we can treat that by going laterally. Do a couple passes on each spot. And finally, in a lot of our cases, we'll have to do some low back traction, and we just go straight up and down, pinning the spine. And a lot of patients will tell you this is the most relieving thing that they can get because it really decompresses the spine, takes a lot of the tension off of those discs, and can really help with our patient treatment. Finally, in our low back pain patients, we are, by trade, chiropractors. And so one of the things that we'll do is we'll go through a motion palpation and we'll see what needs to be adjusted. So we check all of the SI joints. We work our way all the way up the spine. And so we'll find that there's a restriction right in here. He's going to drop his hands. And we're going to have him take a nice deep breath in and all the way out. Good. Okay. Next, what we're going to do is we're going to adjust this SI joint. So he's going to lay on his right side for me. Top leg's going to be there. And one last thing I like to do is I always like to repalpate. So I can actually move his leg and feel if that joint is stuck, which it is right in through here. So we'll have him take a nice deep breath in and all the way out. Good. All right. And come on up. So that's what a lot of our treatment will look like. Soft tissue work, adjustments, but then we're also going to dive into a little bit more rehab and some strategies to build strength up in that low back and prevent this from coming back. Okay, so I briefly touched on our intra-abdominal pressure and our breathing patterns and how impactful they can be on low back pain. I can't stress it enough. And so it's something I teach with every single one of my patients, regardless if their low back pain is a disc herniation, instability, facet syndrome, or any other number of mechanical low back pain causes. So the first thing that I do is I tell a patient, put one hand on the top of your chest, one hand on your stomach. Take 2 or 3 breaths, and I only want to see this hand rise. I want to first start teaching them to breathe in through their stomach using their diaphragm. So go ahead. So you can see this hand rise. This one is nice and quiet. Show it to me. Show it to them what it would look like if it was wrong if you were breathing with your chest. This is what most people will do when we first start. We use all these accessory muscles to breathe through their chest, and there's no pressurization of the lower abdomen. So go ahead and do a couple more breaths like that. This is something I want everyone to practice at home. It's not as easy as it seems, but once you get it, you get it. It's kind of like a switch goes off and you're able to do it. But at first, it'll feel really awkward and cumbersome. So once we have this down, I'll have Stefan take a deep breath in, hold it in through his stomach, and now I'm going to have him lift his legs up. So now he has to maintain this pressure here, which if I push on it, everything is rock solid, which is what we're looking for. And then he has to hold this position. So this is our first position of an exercise. You can hold this for 20 to 30 seconds. He does this pretty well. This can be very challenging, especially if you have low back pain. But if you keep a solid pressure in through there, that can eliminate the pain that you get from moving your legs, or at least minimize it. And so it's a really good tool to use to help modulate your pain when you are in an acute flare-up of your low back. If you're good at it, like Stefan is, we'll throw a kettlebell into it, make it a little bit more challenging. He has to maintain this pressure, so he has not lost the pressurization in his belly here, and he's gonna let his arms go back slowly and come back up. The other thing that a common mistake that we see is patients don't pull their rib cage down. So Stefan, pull your ribs up. So this is a rib flare, and now if you pull them down, now everything is activated. You can see him shaking a little bit. This makes it all the more challenging, and this is exactly what we want our patients to be feeling when they're doing it. And come on back up. Perfect. Okay, so we're gonna grab that from him. So that's a great way to start progression of exercise of low back stabilizing. But the next thing we have to do is we have to address those tight hip flexors. We saw them in the room. Now we're gonna show you how you stretch them here at home. So come on up, Stefan. We're gonna move over to this yoga mat right here for me. Stefan's gonna show what we call a tri-planar hip flexor stretch. So he's gonna go into a half kneeling position. And the key here is his back has to stay neutral. A lot of people, and I'm just gonna demonstrate a little bit here too, is they'll tend to arch their back like this. We want to avoid that. So Stefan's going to, this is what an arch looks like. So instead of arching it, so that's what we don't want. We want him to keep his chest up and push his whole body forward, just like that. That's where you're gonna really feel the stretch right here on the anterior side of his hip flexor. Next, what he's gonna do is he's gonna put his hands all the way up. He's gonna hold that for another 10 seconds. After the 10-second hold, he's gonna lean to his leg that's up, so to the left side, just like that. We're gonna add that second dimension here, so you're actually gonna get a little bit of the lats and the hip flexor are all gonna get stretched at the same time. So there's a couple steps to this one, but it's super effective. The key being, don't arch that back. I can't stress it enough, because this is an exercise or a stretch that if you arch, like if you were to arch like that to try and get more of a stretch here, you may end up actually irritating your back. So keeping it nice and neutral, pushing those hips forward, chest up, just like that. Okay, so we covered some common causes of low back pain and how we can treat it here in the office. But if you're still dealing with low back pain and some of the take-home exercises weren't solving your problem, give us a call at 561-997-8898. We'd be happy to take you through a full exam, get you treated, and get you on your path to feeling better.